Postpartum mood disorders by Montrell Fields. There are many forms of postpartum mood disorders. These disorders affect numerous women across the world. The reason I chose this topic is because so many times this illness goes unreported and or untreated. By choosing this topic, I am able to increase awareness of the effects of this illness, what triggers or stressors can lead to onset, signs and symptoms for mothers, family, and support members to look out for, and the importance of the assessment and educational process of postpartum mood disorders. Not reporting symptoms of postpartum mood disorders or not actively receiving treatment can lead to chronic depression disorders and in some cases, psychosis. It can cause anxiety and irritability as a disruption of stability within the household. Lack of treatment can create bonding issues between mother and child and may also cause developmental issues in the child as well. Children whose parents suffer from postpartum mood disorders are also more likely to develop a long-term effect in their mental and emotional behavior later in their lives. Although there are many social, lifestyle, biological, and psychological risk factors for onset, some main triggers include major hormonal changes, lack of self-esteem, sleep deprivation, inadequate support system, financial hardship, isolation, multi-child births, or children with special medical or developmental needs. Making the patient, family, and support members aware of these stressors or triggers can help them create and implement a support plan to alleviate them as a factor or to prevent onset if it becomes a factor. Making the mother, family, and other support members aware of what to look for can be extremely helpful. Being aware of increased changes in mood, anxiety, fatigue, and restlessness can help to prevent onset or further effects if caught early. Also, listening for feelings of the mother being overwhelmed and implementing a support plan to help can also be a good preventive measure as well. If a mother is having harmful thoughts and delusions, this is a sign of psychosis. This type of postpartum mood disorder is considered an emergency and needs immediate attention, possibly even admittance into a mental health facility. Our roles as nurses and caregivers allow us the tools and knowledge to assess and educate parents, their families, and other support members on postpartum mood disorders and their possible effects and outcomes. Completing a proper postpartum assessment can identify risks relating to the patient's current living, social, and support situations, and also identify symptoms that the patient may already be displaying or feeling. A postpartum assessment is administered at least once within 4 to 6 weeks after giving birth. After 4 to 6 weeks, pediatricians continue postpartum assessments on the mother as part of the well-child visits for the first year after birth. This is done as a precautionary measure for the welfare of the child. Educating the patient on what postpartum mood disorders are and the effects they can have play a proactive role in receiving treatment or preventing onset. Also, helping the patient to understand that these symptoms and feelings do not make them weak or less capable or deserving of being a parent, but that seeking treatment demonstrates a responsible parent and looking out for the needs and well-being of their child. Educating family and other support members of postpartum mood disorders and the signs, symptoms, and effects provides them the knowledge for additional observation outside of the patient observing herself. Both the assessment and education of postpartum mood disorders is essential for prevention and or intervention of postpartum mood disorders for the welfare of the mother and child. I hope that this brief presentation has increased your awareness and understanding of postpartum mood disorders and the effects it has on women across the globe every day. Thank you.